We are seeing a lot of cardiac arrests, even in athletes, seen as the most resilient of the entire society.
What are the common injuries that people can get during exercise? I mean, people do start exercising, and especially recently, what we have noticed is that people drop dead while in the jogging machine or on the elliptical, or if they are running or simply playing cricket.
See, every individual is different. What kind of health issues they have gone through, especially post COVID, things have changed a lot. A lot of people do have some silent pathologies in their heart, which could manifest when people just get too enthusiastic, and then the weekend warriors is just trying to do everything on one day. The key is to gradually build, not to suddenly go from doing nothing to a high intensity exercise. So people just directly hitting the gym, and directly going for a high intensity workout, that's not the way. So you have to build certain levels of endurance before you take up that kind of activity. We are seeing a lot of cardiac arrests, even in athletes. Can also have certain things that silently it's there in the background, you don't know, but always better to prevent than to cure.
Welcome, dear friends, to another episode of Homeomitra Vartaalap, where your growth is our goal. We ensure that the guests that come on our Vartaalap will always share something that is going to be useful to you in your daily life, a knowledge that adds value to your life. Today, we have with us Dr. Khyati Vakharia, who is a sports medicine specialist. Dr. Khyati, if you would allow me to introduce you, she has done her MBBS from Bangalore Medical College and Research Institute, Bangalore. She is a sports medicine, and not just that, she is a gold medalist from the Sports Injury Center, Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi. She is a former international athlete. She has represented India in the Asian Championships. She is a 7 times national champion in pole vault and athletics. She is an All India University record holder, national meet record holder in pole vault. She is a national indoor record holder, national medalist in gymnastics. She has participated in the Fit Kid World Championships. She is an Eklavya awardee from the government of Karnataka for outstanding achievements in sports. She has also been awarded by Dr. ABJ Abdul Kalam for the Outstanding Student Award at the Bangalore Medical College. She is a team doctor for the Indian team, which represents in the Asian Athletics Championship, Bangkok. She is also part of the medical commission in the Athletics Federation of India. She is IOC, that is International Olympics Committee certified sports physician, and she is World Athletics certified level 2 athletics coach. She is also a speaker at various national and international conferences. So, welcome, Dr. Khyati. The list of your accolades is very long and rather very convincing for all of us that there is nothing but a lot of good knowledge and a lot of good sharing that's going to happen in today's podcast.
Thank you, Dr. Kaur, for having me on the podcast, and I'm really looking forward to having really good conversation here.
All right, great. So we start up with the first question. So, Dr. Khyati, could you please tell us something about your journey of becoming an athlete and a sports physician, and why did you choose athletics and sports medicine? This is a very unique combination that comes up in someone who is an athlete, who became a doctor, and in that you specialized into sports medicine. So, if you could tell us your journey and how all it started and how it was.
So my journey as a athlete was very long, and somehow it was through my childhood. I think it was just a way of life for me. And my mother inspired me, and she always pushed me into sports, and she wanted me to be an all-rounder. So that's how it started. The journey has been long, and as an athlete, you don't know where it's going to take you, but then the journey, that's what matters. So being an athlete was one thing, going through all of those experiences, getting injured, getting back to full fitness, competing again. So I think the part where injury came in, that's where the road to sports medicine, I think, was paved. Where being a doctor myself, I was unable to cope with injuries. I was unable to find out what is the way forward. I didn't have anybody to guide me in that way. So that's where I saw that the athlete on the field and the doctor in the hospital, there was a big gap. And that's where sports medicine came in, and my journey to bridge this gap between the athlete on the field and the doctor in the hospital was something that made this way into sports medicine.
Well, that's interesting. You are actually one of a kind who could actually help athletes, and it seems like you have entered into that profession eventually.
Yes.
So, going on to the next question, what does it take to become an athlete? What are the motivations, challenges, and what is the result that comes thereafter?
I think every athlete has his or her own story. There's no one way but there are certain things which are common to all the athletes is the discipline and the consistency. Being an athlete is an entire journey by itself. And most important thing is, you're ready to go back to the training ground or you're ready to go back to the stadium and do the same things over and over again till you perfect it. So being an athlete is mostly consistency, doing that work when nobody is seeing you, consistently grinding. I think that is the most important attribute that an athlete should have. Along with it is the discipline for that consistency. And the most important thing is there may be a lot of athletes who are talented, a lot of people who are talented, but may not make it to the highest level because one thing that makes a difference is opportunity. How many people get that opportunity? Do you get the right opportunity at the right time? Do you have that guidance? So I think that's what makes a difference between somebody who is still consistent, doing all the right things, but not getting that opportunity where his career can turn around. So I think opportunity, like in any other field, for an athlete, getting the right thing at the right time is the key to success.
I agree a lot on this because, like you said, that everyone does their job well, probably, and some of them even do it better than someone who has actually been selected. But then it's a matter of opportunity. So, Dr. Khyati, moving to the next question, what is the importance of exercise in day-to-day life?
So, exercise is for everybody. As humans, our primary instinct is to move, and to move is to exercise. So, I think it is the basic thing that no matter what age, no matter how old, how young, everybody should exercise. So, WHO has put out guidelines that every adult should exercise for anywhere between 150 to 300 minutes per week. So, which is approximately 20 to 40 minutes per day of any kind of aerobic activity based on where you are. Like, could be running, it could be jogging, it could be walking. Along with it, at least 2 times per week, doing some strengthening exercises, which involves more than two muscle groups at least. So, this is something which is just for your normal general day-to-day life, preventing your lifestyle diseases. So this is something basic that needs to be done by everybody. Then comes the differentiation, whether you're an athlete and then you're training for something, then your demands are higher. So those things change, whether you're a child, whether you are a grown up. So then those things will change. But at the end of it, everybody needs to exercise.
So I agree. And in the given increase in the lifestyle disorders that we are seeing nowadays, and obesity and cardiac issues and cardiovascular, strokes and everything, it seems that this is all the more necessary.
Absolutely.
Okay. So what are the common injuries that people can get during exercise? I mean, people do start exercising, especially recently. What we have noticed is that people drop dead while on the jogging machine or on the elliptical, or if they are running or simply playing cricket. So two things. I mean, sorry, this not part of the original question, but yes, one is what injuries do they get, and about the incidences of cardiac arrest that come up because of this.
So one thing is before exercising, see, every individual is different. What kind of health issues they have gone through, especially post COVID, things have changed a lot. A lot of uh, a lot of people do have some silent pathologies in their heart, which could manifest when people just get too enthusiastic, and then the weekend warriors is just trying to do everything on one day. So, the key is to gradually build, not to suddenly go from doing nothing to a high intensity exercise. before exercising, to have a consultation with a doctor, making sure that everything is okay, you're allowed to exercise. If you're on some medication for a long time, definitely go to a doctor, get yourself checked. There is no harm in getting a wellness visit to just make sure that you get your blood tests and you get your health checkup every year. So why not just once before you start exercising or before you taken up something, and then to gradually build from know where you are, and then gradually build through as and when you adapt to a certain level of exercise. So people just directly hitting the gym and directly going for a high intensity workout, that's not the way. So you have to build certain levels of endurance before you take up that kind of activity. We are seeing a lot of cardiac arrests, even in athletes who are seen as the most resilient of the entire society, can also have certain things that silently it's there in the background, you don't know. Sometimes it may also happen that you went through when you went through some tests, you did an ECG, everything looks okay, but suddenly they could have a collapse. We cannot prevent something that we don't already see, but always better to prevent than to cure.
True. Now it seems to me that probably a sports medicine consultant would be helpful in such a case. Like, for example, let's say if commonly, for example, after 30 years, people usually start, this is what I've observed, they at least think of starting exercise. By that time, they are into their career, working. Maybe they don't give that much priority to health. But when they start exercising, do you feel that a sports medicine consultation would be perhaps helpful for them?
Yes, definitely. So a sports medicine consultation would give them a little bit of guidance as to how to start, what intensity to start at, how they should progress, how fast they should progress. Do they have any other health issues that they've been, having for some time? How that would change the kind of exercise that they would do. Now, somebody is hypertensive or somebody is diabetic. So the kind of exercises that you would start with would be completely different. You've been having diabetes for a long time, that changes the kind of aerobic exercise you would do. Having hypertension would change those things. So it would always be wise to consult a sports physician in order before you start exercising, in order to get an overview, then also to keep you motivated that yes, you're going to start from here and you're slowly going to build, and it's a process and you have to stay consistent at it. So it could be a point of motivation also.
So I asked the question to you because until now, at least I have not been aware of a sports physician getting involved into developing a exercise or a fitness routine, not just for any beginner, but also for someone who has got multiple health issues going on at the same time. This is interesting, and this is something I would request all of you who are listening to be aware and mindful of. You can always search for a sports medicine specialist, a sports physician around you. Take consultation whenever it is necessary, and this will ensure that at least you will not face those abrupt health issues that come up because of this.
Correct.
Uh, Going to the second part of the question, what are the common injuries that someone who has not exercised much and has started exercising, and someone who is a athlete would get during exercise?
So some of the most common injuries that happen in people who go to the gym or have just started exercising, you see a lot of knee issues, shoulder issues, back issues. Sometimes they may be overzealous, twist their ankle. Ankle issues are also common. So the kind of issues that you see in the general population versus somebody who's been in the sport are a little different, in the sense that when an athlete has been training, he's been training for many years. So you see, yes, you see those those injuries that happen within the game. Their acute injuries happened in between play. They tore their ligament or they twisted their knee, they dislocated their shoulder. So those are the bigger injuries that an athlete would face because of the nature of certain sports. But in individuals who have not been exercising, one would be their weight issues. So because of their weight issues, they may have alignment issues. And that could lead to muscle imbalances, and that could lead to some of the injuries that they may develop over time. And those are a little bit of a long-term injuries that they would face. And if those alignment issues are corrected in the beginning, or certain exercises are prescribed for correction of that, then it would help them in preventing a lot of injuries which would otherwise happen.
True. And I'm actually now gone into deep thought, and I'm sure people listening to this will go into deep thought. Now, I hope, dear all, do you realize the importance of, I mean, that word alignment, that itself has got a different science altogether. Because if your leg or your back is not aligned while exercising, it can mean havoc if you pull the weight in the wrong direction or something like that. So again, very critically important. Dr. Khyati, I remember this case from what you describe right now, and why the reason I'm sharing this anecdote is because now I became more aware. Because I remember having a kabaddi player as my patient, and she had a very bad knee injury. I'm not very sure what was the nature of the injury, but her ligaments were terribly torn. So then I asked her, how did you rehabilitate? She did not have any problem with rehabilitation. And I remember her telling me, because the muscles of the legs were so strong that even with that injury, she could do weight bearing. Vis-a-vis someone who was not an athlete and would have had that knee injury, perhaps the result would have been different.
Correct, absolutely. So we have a lot of athletes who come in, they would have dislocated their shoulder or they've hurt their knee, but just the fact that they have really good muscle around the joint, that in a way compensates for any, major injury. So when they may present in a way that, I feel okay. Like, yeah, I can still walk, I can still do this. So, because the muscles are so strong around that joint that they don't present in a way that somebody else, a normal person who would not have that kind of muscle, would present.
True. And with that, this is going to come towards the end of the podcast, is what is going to be the right age to start exercising. So hold on, dear viewers. We'll take up other questions in the meantime. The next question, therefore, would be, is there any way to prevent these injuries?
Yes, there are ways to prevent injuries. One, the first thing and the most important thing that would prevent like half of the injuries would be a good warm-up routine. A good warm-up can prevent 50% of your injuries. So one would be that. Second thing would be, you should listen to your body. You should know when your body has adapted to a certain level of exercise, when you're ready to move on in terms of intensity or in terms of volume or in terms of frequency. How much rest your body requires for the amount of exercise that you've done. How well are you sleeping? So that also impacts your recovery, and that would also help in the adaptation to whatever you've been trying to do. So along with that, like, and the bigger things that we see in the clinic, we see the alignment, we see any muscle imbalances, we see any kind of compensation when they're doing just normal, like even just walking. So do they have flat feet? What are the other risks that could be there? Do they have any other medical conditions that could affect their tendons, their ligaments, their joints? What is their kind of lifestyle that they're doing? What is the kind of nutrition they're getting? Are they eating a lot of processed food? So all of those things matter, but the bigger things is listening to your body, making sure you get very good sleep, progressing in a way that will help you get better and better by minimizing the risk of injury, and knowing what kind of activities you need to do based on your goals. For some it may be just losing weight, for some it may be building strength, for some it may just be I just want to be confident, and it's more of like that, the body feeling. So what is the end goal, and that's how you should progress depending on what you want to achieve.
Now, after listening to you all this while, there are two things that come to my mind. One is, I don't know where was sports medicine all the time, because it seems it is even more important than preventive medicine, the PSM which we used to study. I mean, this forms the basics of it. Imagine having a bad knee or a bad ankle, and you are probably the patient is disabled for life. I mean, it is better to prevent the injury rather than having an injury and rehabilitating, because then probably the rehabilitation would also be easier if you have got good muscle strength and good alignment.
Correct.
is there any right way of doing the exercise?
So, in a way, there's no universal right way or right exercise as such. But depending, as I said, depending on your goal, depending on where you are, so exercise is for everybody. There's no particular age where you start exercising. Once a kid learns how to walk, that's when they start exercising. So it's just for them. It's in terms of play, in terms of fun. But as you grow older, it takes a little more structure. As you become adult, then your goals are different. Your goals are to lead a healthy life, you to prevent all those lifestyle diseases. So the goal is the most important thing, and the right way to exercise would be more of the exercise that you're doing it the right way. The amount that you're doing is right enough. The amount of days you're taking in between before you repeat the same exercise, that is what becomes important. So that you get the maximum adaptation to the kind of exercise that you've been doing. So I wouldn't say a right way or a right exercise, but doing it the right way is more important.
If I have understood it right, is it true that then it is never too late to exercise? I mean, someone who is in their 50s, 60s, 70s, can they still start exercising when if they've not exercised their entire life?
Yes, there is no right time. Every time is the right time. So whether you are a kid who's just started to walk, or whether you are a 70-year-old, and it becomes all the more important as you get older, because as you get older, the bone mineral density decreases. Your osteoporosis is so common. Your muscle strength decreases. So your chances of having falls is more. And even a trivial fall at an older age can have devastating outcomes. So it is all the more important for older people to do exercise, to do it in such a way that their muscle strength is at least improving, or at least staying the same but not deteriorating. So that, and there is something, there are exercises for fall prevention in older people. So there are certain types of very simple balance exercises which are there for the older people, and they should do that in order to prevent falls, to improve their own lifestyle, plus mentally, physically, emotionally, and that they are more confident at an older age.
That brings me to my next question, whether I mean, I understand doing the exercise the right way is important, but are there any differences when it comes to age, gender, when it comes to exercising? Say, for example, for females, it's a different routine. For children, it's a different routine. For a
Yes,
different age.
absolutely. So when we just see differences between males and females, completely different. So males have a hormone which is called testosterone, which helps in the muscle growth, which helps in maintaining the bone density. So for males, and also for males, because of the testosterone, it's easier to lose weight. On the other hand, when you see females, they have an entire cycle where their hormones are fluctuating. What they feel during one part of the month, they may not feel the same during the other part of the month. So the exercise prescription for a male versus a female would be different in that sense. So for a male, you would give more like of strength based exercises. You could go to HIIT and those kind of exercises a little faster. But the drawback would be they would have less flexibility. They may not have the best coordination. So those are things which are drawbacks for males. When you see females, just because of the hormones, it may be yeah, gaining strength may take longer time. So the exercises and the strength routines will be different for a female. So that, and the kind of the jogging, the walking, the jogging, all of that also is important to maintain the bone mineral density. So that's how it becomes different in terms of the just the physiological makeup of males and females. With kids, the younger you are, you just, start to walk. Everything is just fun. As you become adolescent, then there's a little more structure towards your exercise program. If you've taken up some sport, then, things change even there. So, how, and then even for the older people, as you grow older, as I said, balance and those kind of training become more important. So, and even with females who, given birth to kids, their pelvic floor muscles are very weak. So, focusing on those kind of exercises also becomes very important for females. So, completely different how you would treat a male versus how you treat a female.
Well, it seems like each topic is very specialized and perhaps it will need a lot more time and a lot more justice. But yes, Dr. Khyati, you have more or less given enough orientation to people so that at least they will start thinking and they will start approaching the sports physician for the concerns related to their physical fitness. And I also remember, if correct me if I'm wrong, I want to bust this myth when you talked about the pregnant females and those who have delivered babies. Uh, they too can start their exercise, and perhaps there is this myth that one cannot exercise during the menstrual cycle.
Yeah. So first I will answer the pregnant uh, ladies, exercise. Uh, Culturally, we've been a more conservative population where during pregnancy, exercise had been seen as not a good thing. But with the rise of lifestyle diseases, a pregnant woman is very uh, prone to having gestational diabetes. They're more prone to having hypertension. So, all the more important for the pregnant ladies to take up exercise. We want to bring down our maternal mortality. This is the way. They have to exercise. Yes, there may be circumstances, there may be certain conditions where you would not allow somebody to exercise, and that is why a gynecological checkup is very important. Getting clearance from your gynae is very important before you would take up any exercise. Now, supposing you have a female who has been exercising even before she got pregnant. So, there is no reason to stop exercising just because you got pregnant. So, anybody who's has been exercising, gets pregnant, will continue the exercise. Yes, the intensity may vary. You bring down the intensity. You may do activities where you want to prevent any falls, or you want to prevent any compromise to the child in the womb. But just being pregnant and stopping exercise is not the way. So you want to have a healthy pregnancy, you should exercise. So this is something that has to be promoted in our culture, that pregnant women have to exercise. Coming to the menstrual health and exercising during your menstrual cycles, even that is very individualistic, in the sense that the kind of symptoms that one female may have is very different from the symptoms that another female may have. Some people can just get through menstruation and they may be absolutely fine, they can do all their activities. But on the other hand, there may be some females who would not be able to do anything. For them, getting out of bed also may be a big deal. So it would be individualistic, but nevertheless, one day before your cycle and the first day is somewhere where you reduce the load of your exercise, where you reduce the load of your core or your lower body strength training. But you can always catch up the next day. Should not be an issue unless somebody is having a lot of symptoms where doing the exercise is getting them to just, they're not able to tolerate it at all.
The last supplementary question to this I would like to ask is whether exercise can prevent premenstrual syndromes, cramps, uneasiness, and all those things which are there.
Yes, absolutely. So, especially towards, like, that phase where you're, closer to menstruation, doing things where you reduce the intensity, you do things like yoga. Those things can really calm down your nervous system. It can help you cope with the premenstrual stress, and it can also reduce your premenstrual symptoms. So even simple things like, reducing your caffeine intake at that point can help. There are a lot of things. Some people, they feel very bloated during that time and they're unable to do. But just moving, doing certain things calms your mind down, reduces the stress, and that can help in, coping with the premenstrual syndrome as well.
Well, that's quite enlightening, and I hope that this knowledge will ensure that females, particularly, they will make good use of exercise to help themselves with premenstrual syndrome. All right. So, for now, if you are not a doctor, I would recommend you can stop watching the video right now, because the next few questions are going to be about the medical specialty, which might be a very technical subject. If you want to listen, no problem. Knowledge is good for everyone. But nonetheless, uh, what can a family physician or other specialties need? What should they know about the role of a sports physician?
Yeah, that's a very good question. So, what any other doctor needs to know about a sports physician is that one, a sports physician works in collaboration with the family physician, with the orthopedic surgeon, with the physical therapist, with the cardiologist, with your nutritionist or a dietitian. So it is complementary to all of the other fields. What a sports physician specializes in is dealing with diagnosing management of any sport related injuries of athletes or anybody who has had some injury to their musculoskeletal system as a result of some activity. That is the first thing. But the holistic approach that a sports physician brings in is they also deal with the non-musculoskeletal injuries. So they deal with things like, like asthma or, diabetes in an athlete. The management of that and how a person or an athlete would still continue to compete having a certain medical condition, that becomes a very big part of the holistic approach of a sports physician. Other than that, a sports physician does a lot of interventions, ultrasound guided interventions, PRP injections, the shockwave therapies, and also like prescribing the exercise in order to prevent those lifestyle diseases. So this is like a broad concept. And the other role that a sports physician takes in terms of sport is being the team physician, taking care of needs of the athlete, traveling with them. That is one part. With even the athletes, doping is a big concern. There are certain medicines that you would be able to give in a disease to a normal person, but the same medicine could not be have given to an athlete. So that's where the difference comes in. What is the sport? Is this medication allowed? Not just in the terms of doping, but also in the terms of, will it affect the athlete health? Will it affect his performance? So all those aspects are also seen by a sports physician. So this is like a broad overview of what a sports physician does, and the role is always complementary, and everybody works in collaboration.
Dr. Khyati, does that also mean that, let's say, for example, an athlete or has a bronchial asthma, and let's say there are some medicines. I am a homeopathic doctor, so my knowledge about allopathy is there, but it is limited because I don't use it in my practice. That, let's say something like, I remember there is a medicine called as terbutaline, and there is something called as escibrofilin, which increases the heart rate. Now, does the sports physician also help to regulate these medicines for athletes?
Yes, first of all, terbutaline is banned to be used by an athlete. So the biggest thing and the challenge is, sometimes athletes may just go over the counter and they may just have a simple cough or something right before their competition, and they go to a medical store. The person does not know, gives him a cough syrup which contains terbutaline, and he plays the match, gives a dope test, and turns out to be positive and is banned for 2 years. So when that happens, it's very bad for the career of the athlete, very bad for his repute, just because he didn't know that that particular cough syrup contained a medicine that was banned. So, that the magnitude that it would take and impact the athlete's career is far more than anything, because time is everything. You have a limited time where you want to achieve those athletic milestones. So, losing out on that with a simple mistake of just going and getting a cough syrup. And, then the athlete thinks, I could have just done without this. That's the magnitude in which it affects the athlete.
And that's quite intense and serious, but at the same time also highlights the importance of sports pharmacology, as I would use the word.
Absolutely.
Well, we are coming towards the end of the podcast, and this question intrigues me because I have a very special kind of a sensitivity towards students, and particularly medical students. What message would you like to give to them, someone who has done their MBBS and who aspires to become a sports physician, whether MD in sports medicine is the only option, or if there is something else they can do, how can they prepare for becoming a sports physician? How many colleges are there? How many seats are there? What kind of competition is there, India, abroad, in that order?
Yeah. So, first of all, if you want to get into sports medicine in India, so the what the Medical Commission of India, what the NMC guidelines are, and what is recognized to be practiced, like who can practice with that certain degree in India, is only a MD in sports medicine or a diploma in sports medicine. So now the admission of this happens through the NEET PG exam. So you have to appear for the NEET PG exam. You have to qualify, you have to get a rank. This branch is still in the budding stage, and there are few colleges which offer the course. So if you were to look at North India, it would be the biggest center is Safdarjung Hospital, VMMC in Delhi, that offers 6 seats from this year on. There is PGIMS Rohtak, which offers 2 seats. There is RIMS Impal that offers seats. PG Diploma in Sports Medicine is by Sports Authority of India, Sai Patiala. So that offers PG Diploma in Sports Medicine. That's the only institute that offers diploma now. Coming, uh, Coming to the middle of India, Armed Forces Medical College, Pune offers MD in Sports Medicine. Now there are few colleges in South India that also offer MD. One is the Chettinad College. SRMC Chennai is a private college that offers sports medicine, MD in sports medicine. Bangalore Medical College has come up. Savita Medical College in Chennai. So these are few of the colleges that offer. Now KGMC, King George Medical College, Lucknow also has come up with seats for MD sports medicine. So slowly medical colleges are coming up with this specialty, but the some of the biggest centers and the oldest one is the Sai Patiala Center, which had its PG diploma for a very long time, and that's where was the origin of sports medicine in India.
So that's almost like 10 to 12 colleges which you have listed. So yes, there is a scope for someone who aspires. They can do it well within India, but perhaps the number of seats are not very many. Okay.
Yes, all the state colleges offer about 2 seats. Our Central Institute offers 6 seats, which is a bigger institute. But most of the other colleges offer 2 seats.
So unlike other branches of medicine or surgery, there is no DNB. Is there any DNB in sports medicine?
No, not yet. There is no DNB in sports medicine as yet.
Okay, interesting, interesting. And how does a diploma differ? And I mean, obviously it differs, but then when it comes to practical application, how does a diploma differ from MD in sports medicine?
So when you do a diploma in sports medicine, you don't like formally do a thesis. You don't submit a thesis, and that's where the biggest difference comes in. So an MD in sports medicine is also more research oriented than a diploma. But nevertheless, when you do a diploma, you go through the same things, like you see the same things. It's just, it depends, like every institute in India has sports medicine a little differently, in the sense that there is so much in sports medicine that every facility may not be available at every center. So when you see SRMC Chennai, they are very big on, like, they have a biomechanical, like they were the first one of the first colleges which had the biomechanics. So biomechanics is their strong point. When you go to AFMC Pune, exercise physiology is their strong point. Now in Delhi, we have everything under one roof. That changes things. But when you look at the other state colleges, so everybody has a little bit of their own strengths. There are certain things which are a little more predominant in certain colleges.
Right. And is there any, let's say, fellowship or a kind of an education after you complete your MD in sports medicine in India?
There's no fellowship after you complete an MD. There are a few fellowships after you complete MS Orthopedics. So there is an All India exam for fellowship. And in our center, we have 2 seats for fellowship post MS Orthopedics. But post MD Sports Medicine, there are no fellowships.
And what is the kind of scope abroad, whether someone who has done their MD in sports medicine, whether they can straight away go abroad, get a license to practice, or do they need to take up more education over there?
No. So if you do an MD in sports medicine here, it's not like you're going to just straight go abroad and start practicing. No, because the scene of sports medicine in every country is different. So when you go to, say, when you go to US, they have their own thing. So you have to become either a family physician or a pediatrician, or you have to do a specialty before you get into sports medicine. While there are other countries like Australia, the UK, where there are specialities, which is sports medicine. I think even in the UK, you still have to be like, you have to go through family physician, or you have to do some course before you do sports medicine. So how they recognize sports medicine is completely different. And that's what makes it a little challenging, that you cannot just jump, like you did your MD in sports medicine, you cannot directly take that jump there.
Right. And how are the career prospects when you once you complete sports medicine? What are the let's say jobs, or I mean entrepreneurship or self-employment is something completely different. But otherwise, what are the opportunities? And of course, I would also like to understand if someone is starting a private consultation, whether there is any awareness or scope right now.
Yes. So one thing would be, going back to institutes. That would be a bigger part. Like you get into institutes on the, like, your senior residency, you get into as faculty, assistant professors. So that is one, the institution route is one route to take. The other route is when you're thinking about private practice, it becomes a little challenging in the sense that a lot of sports medicine is dependent on a lot of testing, a lot of machines, a lot of equipment, which is expensive. So if you want to have your own full-fledged setup, it would be pretty expensive to, start off. Like, you would have to have a good investment. Nevertheless, you can still start off. You can have your clinic. There's no issue. You can have collaborations and you can do it. So that is the other way to go. Then the third way would be getting into a role of a team physician, traveling like with the cricket teams, the other sport, getting into IPL, getting, like, those are the other opportunities that a sports physician would get. So these are broadly, how what the prospects are in terms of after you finish your MD in sports medicine.
Well, I guess that brings us to the end of our podcast. Dr. Khyati, thank you so much for sharing such in-depth and actually practical, useful knowledge for all of us, not just for people around the world who will be listening to this, but also for medical students. Uh, the end of the section of Vartalap is something called as Vartalap motivation. Now, I would want you to give us all a message. One for people who are not in the medical facility, in the medical faculty, and for those who are in the medical faculty. If you could give one inspirational message to both of them, one each.
Uh, One for everybody is get up and start moving, because once you're moving, everything in your life moves. So that's one of the message that I would give to everybody. And what a message I would give on the medical side, especially to aspiring students, is always choose a branch that you're passionate about, no matter how other people view it. And don't choose a branch just because everybody is choosing it. So, everybody is different. So, always go with your passion.
Really inspiring. Thank you, Dr. Khyati, for being part of Homeo Mitra Vartalap. I thank you, and I thank you on behalf of all our subscribers. And yes, certainly we will try and have Dr. Khyati back again on the podcast for a different topic, perhaps. So if there is any topic that you would like to listen from her, do mention that in the comments. If you have any question, do mention that. And then, of course, once we accumulate all those comments and questions, we will try and get her back for the podcast once again. Thank you, Dr. Khyati, once again.
Thank you, Dr. Keor. It was wonderful, talking about all these important things where, people don't know. Even as doctors, sometimes it's difficult to explain to them what this branch is all about. And, thank you for going through all of these questions and having such a nice conversation. Thank you so much.